So I'm excited that you have decided to take a deeper dive into the actual strategic plan that we've developed. We're calling this Bridge to the Future because that's what this is helping us bridge from where we are today into the future. So a few things that we're going to look at over the coming slides. We're going to review our mission, purpose, vision, take a glance at where we are today, our SWOT analysis, some proposed problems and solutions, and then ultimately where we're headed. And then we'll end with some nuts and bolts around our actual 18-month strategic plan. So in case you didn't know, our mission is that we are a Christian organization that supports people with intellectual and developmental disabilities. And I highlight that word people because that's a change for us. In August of 2023, our board decided to change the word from supports adults to supports people because we believe that we should be supporting folks across their entire lifespan, not just adulthood. So we changed the word from adults to people. Out of our mission flows our purpose, and that's simple, that in a Christian environment, we seek to enrich the lives of persons with intellectual and developmental disabilities. And then ultimately, our vision is to strive to be that model agency, providing evidence-based, innovative, and creative supports to the entire community of people impacted by an intellectual or developmental disability. So take a quick glance at where are we today. So today we have 10 residential homes in Macon and one down in St. Mary's, Georgia. This is right on the Florida-Georgia line outside of Jacksonville, Florida. And then in Macon, we actually have 2 apartments. Our Cornerstone Day program is here in Macon. And then we have some emerging programs, supportive employment, community access individual, which is really just one-on-one supports out in the community. And then our nursing program. Our capacity today is 44 residential beds plus the 2 apartments, and Cornerstone Day program can accommodate about 55 people any given day. The graphs show the age of our residents. So the one on the top is the age. And as you can see, about 50% of our population is in their 50s, 60s, or beyond. The rest are in their 20s, 30s, or 40s. So this shows us really that we have 50% of our population is entering into older adulthood. And so that's going to have an impact on our future programs and services. And then the graph below is really the scope of disabilities. And for those of you that don't know, there's a classification system. It goes mild, profound, moderate, and severe. About 40% of our folks are in the mild category, 21% profound, 29% moderate, and then 5% in the severe category. July 22 through June 23, our financial strength is, we're actually in a very good, strong financial position. Total income was right at about $5.5 million. What's important to see there is the income primarily comes for programs and services and through programs and services. We bill Medicaid to generate that revenue there. The rest of it is done through our development department, donor relations, fundraising, writing grants, seeking out foundations to support the work that we're doing. Flipping over to the other graph, it's our expenses. And we're pleased that the bulk of our money goes to the direct services supporting the people that we serve. Then you can see 12% support services and 7% fundraising. Again, the money that we're spending to make sure that everything happens the way it should happen to support our programs and services. So the next 3 slides are going to take a look at services available through the Medicaid Waiver. And this is the full menu of options that Medicaid provides us. But if we look here at the next slide, these are the current services Wesley Glen Ministries has been offering. In the green, you'll see community access services. That's our day program. That's Cornerstone. Community residential alternative services are residential homes. And I mentioned we have nursing services that are beginning. And then we also get a little bit of reimbursement for some specialized medical supplies. Now, the next slide is the interesting one in that those things that are in blue or light blue are potential opportunities for growth. So additional staffing, skilled nursing, nutrition, occupational physical therapy, behavior supports. I mean, you can see the list there. You add those to the ones that are in the green, and I think we could really have a robust menu of options to provide increased support for the people that we're serving. Now, those that are in red and crossed out, those are some that we cannot do because of the nature of what we do, or they just don't make sense for Wesley Glen to do. So a quick glance at our strengths, weaknesses, opportunities, and threats. Strengths, we got pretty good client satisfaction, family satisfaction. Our organizational chart, over the past several years, we've added some positions to really position ourselves for growth and change. We do have the ability to maintain full staffing patterns. As I mentioned earlier, we have a strong financial standing, and we've got strengthening relationships with state and community partners. Now, some of the weaknesses. We have some issues with competency within frontline staff and middle management. It's not that they don't know what to do, it's just I believe and we believe that they can improve their skills to reach a higher level of competency. We certainly have some aging homes and infrastructure across our campus. Going back to the funding, we have a high dependence on state Medicaid funding. Again, that is the bulk of where our funding comes from. We have a lack of board-approved policies and procedures. However, the past several months, we've actually made tremendous progress on those areas. And then campus security is always a concern for folks, as we are an open campus so that anybody can come onto our campus. Now, some opportunities. Our campus is large and it has room for expansion, diversification of programs and services, or other use of our facility to generate additional revenue. We have state partners that are desperate for solution-focused agencies. We've got strong connections across the state of Georgia, and we have financial reserves to make immediate improvements. Potential threats, we do pay our frontline staff $15 an hour, which is more, actually substantially more than the average wage in the state of Georgia for DSPs. But as you know, $15 an hour is rapidly becoming the new minimum wage. It seems like everywhere you go, you can find a job for $15 an hour. There's also some restrictive regulations towards campus-based facilities, which is certainly part of what Wesley Glen is, and quite frankly, part of the draw for people to come to Wesley Glen. And then aging of our current residents with minimal supports as they transition to older adulthood. Again, reflecting back on that graph, 50% of our population is moving towards older adulthood, and how can we begin and continue to develop programs that truly support their interests and needs as they age? So there's some broad problems and proposed solutions. An agency-specific one is our aging homes and infrastructure. So we're going to have to invest in renovations to our current homes, our infrastructure and facilities. We can use reserves and surplus as well as foundations and grants and donors. Quite frankly, these are going to be some expensive costs attached to these, but they are actually very necessary. Another agency-specific challenge is missing supports for people served. Again, we have an aging population, and so we need to continue to diversify our supports to meet the immediate and emerging needs of the people we're serving by developing programs and services currently funded by Medicaid. Likewise, these supports are expandable to individuals with IDD in the wider community. So what that means is you don't just have to live at Wesley Glen to be supported by Wesley Glen. We can expand these supports to the broader community. And then, of course, expansion is going to require some physical space to actually house the programs and services. And then a system-level challenge is there's just a lack of providers in the state of Georgia. And so potential solution here is acquiring more homes, diversifying our residential programs, and expanding supports across the state to meet the growing demand for high-quality programs and services. So where are we headed? 3 basic goals with 3 basic objectives. First goal, fix what we have. Hence the 18-month strategic plan. Second, prepare for what we want. That's going to be a capital campaign. And then third, building the dream, leaning into our vision. That's going to require some hard hats and hammers. Now, at Wesley Glen, we believe that everything should support programs and services. So we try to keep that at the center of our attention. Whether it's finance, development, governance, personnel, facilities, it should all relate back to our programs and services. So as we take a quick glance at these various areas, remember they should all filter into programs and services, which is where we begin. So 3 key objectives here, and I'm not going to go through every word on this slide, but objective 1 is to strengthen the supports provided by establishing clear practice standards for current programs and services. So this is things like finalizing some policies and procedures, creating operational manuals, doing extensive training, making sure we're maintaining our accreditations. Another objective is investing in continued development of emerging programs and supports. So that's supportive employment, the community access, the nursing supports. So there's a lot of opportunity there to collaborate with our state partners, universities, to really just make sure we're performing and doing the best practices available. And then last but not least, collaborating with key stakeholders to strengthen our current programs and services while preparing for growth and expansion. We believe that there's so much we can do, and so today is the day to begin to really work our network, figure out how can Wesley Glen best meet the needs moving into the future. Our finance department has 18-month goals as well. Their objectives include optimizing our budget to ensure resources are allocated efficiently, maximizing impact, and minimizing waste. Also, they're going to be implementing robust financial policies and reporting, reducing dependence on outsourced accounting firms. And then we want to make sure we're building our financial reserves to ensure long-term sustainability and fund expansions and new initiatives. So again, you can take the time and dig through the various action steps and key performance indicators attached to the finance department. Within governance of the organization, part of what we're doing over the next 18 months is assessing and updating our governing documents. Things like reviewing our bylaws, making sure all of our documents are organized, making sure that we have the policies that outline board roles and responsibilities. We're working on developing a strategy for board recruitment and expansion with qualified and diverse individuals, making sure our board composition aligns with state codes and best practices, and really working to formalize our strategy for board recruitment and training. And then, of course, we want to make sure we increase the efficiency of governance responsibilities. Within our facilities department, we want to make sure our infrastructure improvements include updated homes and facilities with the intent to move towards full ADA compliance. Additionally, technological integration to ensure improved communication, service delivery, security, and operational efficiency. And then, last but not least, transportation expansion and modernization, making sure that our fleet of vehicles are up to date, current, and moving us towards the future. Of course, all of this takes people, and so within personnel, we want to enhance professional development by providing opportunities to learn and reinforce skills, values, and core competencies, optimize our staffing levels to ensure the most effective and responsive supports are available, and then ultimately strengthening employee engagement and well-being. So again, you can see the various action steps and the KPIs that we will be tracking. And as I mentioned very early in this presentation, development is a key part of what we do, as we have to raise a good chunk of the money to support the people that we serve. So our development department will be doing some data collection and cleanup, utilizing technology to strengthen their major gift and annual fund programs. They'll be strengthening major donor and foundation connections and strengthening engagement with our current donor database. So our hope is that collectively between these various areas over the next 18 months, we will continue to strengthen the entire organization to help us move forward into the future as we build that bridge from where we are today into that idea of being the model agency that provides evidence-based, innovative, and creative supports to the entire community of people impacted by developmental or intellectual disability. If you have additional questions, please feel free to reach out to us. We would love to share more information with you, dig into the weeds of this with you, or at the end of the day, maybe just take you on a tour of our campus and show you this incredible place called Wesley Glen Ministries. Thank you.